Alarmed by the rapid spread of an Mpox outbreak in Africa, the World Health Organization declared a public health emergency of international concern and warned of possible new cases in the coming days and weeks.
It's clear that a coordinated international response is essential to stop these outbreaks and save lives.
Formerly known as monkeypox, Mpox infections have surged in the Democratic Republic of Congo, with more than 15,000 cases reported to the WHO this year and more than 500 deaths, including many children. It's since spread to at least 13 African countries and has been detected in Sweden and Pakistan too, although it's unclear if the strain there is from the current outbreak or one that circulated during a previous health emergency in 2022. What health officials do know is this new Mpox outbreak is driven mainly by the relatively new Clade 1b variant, which is deadlier than past strains. It's highly contagious and causes flu-like symptoms and pus-filled lesions and is spread by skin-to-skin contact and touching contaminated objects, making it very transmissible in close quarters.
3 of my children and I were infected. 1 was treated here, and the other 2 were taken to another hospital. After 2 weeks, they were discharged from the hospital, and a week later, my wife was infected.
In severe outbreaks of Clade 1 Mpox, the US Centers for Disease Control says up to 10% of infected people have died from it, with health officials particularly concerned about vulnerable populations like pregnant women and children.
It's particularly dangerous for those with a weak immune system, so people who maybe have HIV or who are malnourished. And as you know, in the area that it's spreading very rapidly, Eastern Democratic Republic of Congo, there are a lot of people who are displaced because of conflict.
Countries like Pakistan are taking precautions to try to prevent further infections by screening passengers in airports and fumigating luggage carousels and common areas. Sweden's state epidemiologist says public awareness on Mpox, as well as contact tracing and isolation of patients, are key to containing the virus. And there are talks of travel recommendations, including vaccines for those travelling to the region.
We do have vaccine and we have a stock of vaccine. And we are also discussing together with a lot of other European countries if we need more vaccine.
Biotech firm Bavarian Nordic says it plans to ramp up production of its Mpox vaccine and can supply 2 million doses this year and 10 million by the end of 2025. But getting those vaccines where they are most needed is critical, and right now Mpox vaccines are not widely available in Africa. Michael Holmes, CNN.